After over 25 days and 3 weeks of frozen negotiations, the partial U.S. government shutdown is now the longest in the country's history. Mvskoke Creek Nation Secretary of Health Shawn Terry responded to citizen unrest on the issue with a statement assuring that MCN health facilities would remain open. Mvskoke Media recently sat with Terry as he went into further detail on how the tribe's health operations have prepared and are operating through the shutdown.
Well, we've had a lot of people concerned of whether the clinics and hospitals of the Mvskoke Creek Nation Department of Health was going to close due to this partial government shutdown. And so I just wanted to spend a little bit of time reassuring everyone that we're going to remain open. Everyone is going to get paid with the exception of the Commission Corps officers that work in our facilities. And those commissioned officers, they are federal employees, and they do have to show up for work. They're just not going to get paid. So as you may recall, last year we started our Together We Can Do More campaign, which was really focused on us trying our best to improve our third-party collections with Medicare and Medicaid and private insurance. And we've moved from being about where we've collected 1.6, 1.7 a month to where now we're averaging over 5 to 6 million a month. It takes the Department of Health about $6 million a month to operate at our current standards. We spend roughly about $200,000 a day. And so with the operational efficiencies that we've achieved, we are carrying over probably about $15 million from the previous year, which leaves us reserves, cash reserves of about $15 million in the bank from 2018. And so with us bringing in $5 million a month, we should be good at least for the next year without having any problems at all. So hopefully this government shutdown's not going to last a long time. We think it'll be resolved relatively soon, but we're in a very good financial position that when things like this does happen, we can assure our citizens and our patients that the Mvskoke Creek Nation Department of Health is going to remain open and taking care of our patients.
Terry also took a moment to explain how MCN Health utilizes federal funds.
The Mvskoke Creek Nation Department of Health, we receive about half of our operating dollars from the federal government. So that comes through the Indian Health Service. The Indian Health Service gets its funding through the Department of Health and Human Services. So it's all part of a discretionary budget inside of the federal budget. So we rely on roughly about $56 million a year comes to the tribe in our annual funding agreement, which is just a fancier word for a contract that we have with Indian Health Service. So when we don't have that money, we're relying on our own third-party revenue or what we've saved to run our operations. So that's where about half of our money comes from. And so that's, I think, what a government shutdown means is that the discretionary spending inside the federal government, there's really two types of funding. There is the mandatory entitlement spending, which is like Medicare and Medicaid, the Department of Defense, and programs like Social Security. And then there's the discretionary side. And it just so happens that Indian Health Service is part of discretionary spending inside the federal government. So many of our people believe that Indian Health Service is an entitlement program, And it's not. It's a discretionary spending. So whenever the federal government shuts down or they have to cut discretionary spending, Indian Health Service is always affected by that. So that's why it's so important for us as a nation to do well when it comes to third-party revenue and Medicare and Medicaid and private insurance billing. Is as we do better with that, that brings in the revenue so that whenever our clinics do experience things like government shutdowns or reduction in spending, we don't have to lay people off or cut our budget.